Today's topic is recovery after lumbar spinal surgery. This is information designed to help you recover as quickly as possible and also to obtain the best possible outcome. If you want to have the best possible outcome, you need to know what to expect postoperatively. And there are three things you need to know about, and they will concern you postoperatively. The first one is pain. And the second one is some numbness and tingling in the lower extremities. Both of those are common, normal, treatable, and should resolve in time. The third thing that may concern you is bleeding from the incision. We close the incision with some glue. We don't use stitches. We put a sterile dressing on top of it. Typically, we leave that in place for 2 weeks until I see you back in the office. If it bleeds enough that it irritates your skin or irritates the patient, then we'll change it. When we change it, we don't clean it, we don't use peroxides, we don't put ointment on it, we just put new dressings. You can take a shower, don't soak in a bathtub, don't go swimming. When it comes to spine surgery, the key is activity. The more you do, the quicker you do, the better you do. Now, we don't want you really lifting heavy objects, nothing heavier than 1 or 2 gallons of milk, but we do want you staying active. Activity is how we avoid some of the more common postoperative complications or symptoms. By walking, you can avoid blood clots in the legs. By walking, you keep the stomach working, you keep the intestines working, you avoid nausea, you avoid constipation. Also, walking is how we get rid of that numbness we talked about in the lower extremities. The big question is, how much pain will you experience postoperatively? Keep in mind, the nurses and doctors will give you medication. They'll give you pills to take. They'll give you medicine in your IV to help mitigate or minimize the amount of pain that you do have. But in spite of that, the first time you stand up, you may have enough pain to scare you and scare your family. Hopefully I'm exaggerating, but it's better to be prepared for the worst and be happily surprised when it's not that bad. The good news is, once you go up and down the hallway 5 long times, you'll feel better, almost like magic. I'm not saying all the pain will go away, but certainly by that point you'll see the light at the end of the tunnel. Your homework after lumbar spinal surgery is to attempt to do normal activities as normally as possible, as quickly as possible. And I'm talking about those activities that somebody has to do to survive the day. So you can walk around the couch, you can't lift the couch. You can walk around the front lawn, but you can't mow the front lawn. You should not look for specific ways to avoid pain. You're trying to get back activity, motion, and function. You don't want to find a special way to sleep or a special way of doing things. You want to try to, for example, put on your own shoes. Now, I'm not saying you'll be able to do these things immediately, but that's your goal. You're trying to retrain the muscles. You're trying to retrain the ligaments, the tendons, and the spine. You want it to function normally again as quickly as possible. I don't want you to overdo it. What do I mean by that? Each day, you should do a little more than the last day. So, walk a little farther around the block. If you walk so much one day that you can't get out of the bed for the next 2 days, then you're not making headway. You've lost ground. So we don't want you doing that. At this point, patients typically ask me, well, when can I begin real therapy? We have to wait till the swelling goes away. We have to wait till the bruising resolves. We have to wait until you have a relatively normal range of motion in your back and you can do most normal activities of daily living. Then you will benefit from more formal therapy to increase the strength, range of motion, flexibility of your spine. If you have a specific goal, so for example, if your employer has told you you have to be able to lift 50 pounds to go back to work, once the swelling goes away, once the bruising goes away, once you can do most activities of normal living, then that's when you'll meet with the therapist and begin an exercise protocol to gain the strength to safely lift 50 pounds. If you follow this protocol, you will do well. The goal is activity as quickly as possible. If I left anything out, if you have any questions, please write me at drsmith@elpasospinecenter.com. I hope you enjoyed this. Thank you for watching. Tell your friends and neighbors to watch. Give us a like and subscribe. Thank you.